Hello, my name is Justine Shelton. This video is my way of offering the healing power of yoga to a larger audience. This video is strongly influenced by Vinny Yoga and the teachings of Gary Krafsow. What you may notice in the practice that follows is that we repeat the movements into and out of the poses in order to increase circulation. And then we may stay in the pose to facilitate stretching the muscles and the fascia. We link our breath with our movement. I also encourage you to use structural alignment rather than a linear alignment. For example, feet hip width in standing poses instead of feet together. This is to ease any strain in the joints or low back. The philosophy here is that we are adapting the poses to suit your body, not adapting your body to fit into the poses. Please keep in mind, the practice is to serve you. Go at your own pace, so rest when you need to. And if anything doesn't feel right, please listen to your body. Your body is your greatest teacher. If you are new to yoga, you will feel the muscles stretching and parts of your body waking up, so to speak. You can use the breath like an internal flashlight, imagining it going into any dark, tight places in your body and bringing in light and space. It is fine to feel the stretch to a comfortable degree. Practice short of your edge. If you feel any knife-like stabbing, shooting, or tingling pain, please back out. It is probably not a good pain. You are inviting your body to open and stretch, but never forcing. I also encourage you to pay attention to your breath as you practice. If the breath gets short or forced, back out of the pose a bit or rest. The breath should be smooth and flowing, using a yogic breath, inhaling and exhaling through the nose with a slight constriction in the back of the throat. It is almost like you are fogging up a mirror, only your mouth is closed. Please be patient with this style of breathing as it can take a while to get used to. Sometimes the mind might wander off. The breath can be a great reminder to bring your focus back into your body, to stay in the present moment. You will hear me mention axial extension in the video. Axial extension is getting the greatest amount of length in the spine, from the tailbone all the way out the crown of the head. In yoga, we try to avoid compression. Before any movement, always think lengthen the spine first, so you have maximum space between the vertebral bodies. I teach from the side of caution, and to be safe coming in and out of standing forward bends, please bend your knees to lessen the risk to your low back. Engaging your abdominal muscles on exhale stabilizes and supports your low back, taking the risk out of the movements. Remember, engaging your abdominal muscles is key to keeping your low back safe. Otherwise, your low back is doing all the work by itself and is vulnerable to injury. Be encouraged that a short daily practice is all you need to maintain your health and strength. It is not necessary to practice an hour and a half every day. That is a great luxury if you can take the time to do it. However, 20 to 30 minutes a day will serve you beautifully. With that in mind, I kept this practice short, so it is doable even with a busy schedule. If you have any chronic conditions, please get approval from your doctor. Blown or bulging discs in the lumbar spine are to be especially cared for. Yoga can help heal and relieve when done properly. However, never push through anything painful. With disc damage, standing forward bends may need to be avoided, as well as twists. Forward bends on your back, like knees to chest, can be very healing for the discs, as well as prone, repetitive back bends. If you have access to a qualified teacher, I strongly urge you to get their support and knowledge, as nothing can replace a qualified eye watching your body directly and responding to your own individual needs. Enjoy the practice.